Today I want to talk about lung cancer. People ask me, what is lung cancer? What are the signs and symptoms? Hello, I'm Professor Dr. Syed Arshad. I'm a senior consultant pulmonologist at the King's College Hospital. I'm also a professor in pulmonology adjunct at Gulf Medical University in UAE. So important to understand is that lung cancer can present in various ways. Sometimes people get coughing, and this is persistent coughing for 4 to 6 weeks. Sometimes they get coughing of blood, which is also a sign for gravity of the problem. There could also be some chest pain that they come with. They could have shortness of breath, and they could have odd symptoms, tingling, numbness, but weight loss, coughing up blood, cough, and shortness of breath should worry us about diagnosis of lung cancer. And hence, once you're worried about it, you should see a doctor. The doctor should make sure a basic chest X-ray is done. It's a very crude way of looking at the whole thing, a chest X-ray. But I think a CT scan, a scanner behind me, is very vitally important, not only to diagnose cancer, but also to stage the lung cancer. There are other modalities in cancer that might also be needed, like a PET scan. Now, PET scan is a scan we inject glucose into the patient, and it's an isotope glucose which goes taken up by the cells which are growing fast. So these are usually cancer cells. So it lights up in the scan, which is called the PET scan, PET scan, and helps us diagnose the spread of the cancer. Sometimes we also need EBUS or bronchoscopic biopsy. Sometimes we do CT guided biopsy as well to make a diagnosis. Now, it is very important to make the diagnosis early in lung cancer. The prognosis is slightly behind just because that the cancer is diagnosed at a late stage. So it is vitally important to catch the lung cancer at an early stage where it is treatable, where it can be resected. There are various modalities of treatment available apart from surgical treatment. There is chemotherapy, there is radiotherapy. So various treatment modalities are now available for lung cancer, and the lung cancer prognosis is improving. But it is very important not to forget that if you have these symptoms, do get yourself checked up at an early stage. Chest X-ray is a crude way, but CT scan is the right test for confirming presence of a tumor or a cancer in the lung. So it is a very important advice to consider when you have these symptoms to please see a doctor. Thank you.